tooth consists of two hard tissues, enamel and dentin. And within the dentin is a soft tissue, the pulp. The pulp consists of blood vessels, nerves, and connective tissue. And this helps root growth as the tooth develops. A root canal may be necessary if the pulp becomes inflamed or infected. In some cases, it may be required if advanced restorative care is required and the dentist requires more space within the root canal to provide the advanced crown or bridge work as necessary. The root canal process involves thoroughly removing the pulpal tissue, cleaning within the root canal as thoroughly as possible using fine instruments and disinfectants. This creates a space which eventually is filled with an inert sort of material. After root canal treatment has been completed, the patient is then referred back to the dentist for either a crown or a permanent filling. This will be down to determine on what tooth is involved in the root canal treatment process and what is required of the tooth during function. There are cases where root canal treatment may be required purely for restorative reasons. Root canal treatment may be required quite often when patients are in pain, or occasionally when it needs to be done for restorative reasons by the patient's own dentist. Usually patients come in complaining of pain either on biting, to hot and cold things. This could be acute or it could be dull. They may come in with a swelling or a sinus discharging pus from the region of the tooth. This causes the pulp to be inflamed or infected. And quite often this is seen in people who've had a lot of fillings, where there's been a lot of decay, deep decay close to the pulp. This causes inflammation within the pulp. And it's a borderline situation that the pulp suddenly will become more inflamed and more symptomatic. It may be infected, in which case the option is also to continue with root canal treatment. There may be leaking fillings, crowns or ordinary fillings, which allow bacteria to enter the tooth, thereby causing further inflammation of the pulp. This, if not dealt with at an earlier stage, could also lead to infection. Trauma is also quite an important reason why root canal treatment may be required, because quite often there are no visible signs of trauma to a tooth, but the pulp is affected. Many root canal procedures are carried out to relieve pain. Modern anesthetic solutions and techniques have gone a long way to make this process more comfortable for patients. An inflamed nerve will require more anesthetic solution, so we have supplementary techniques that we can use to relieve the anxiety and pain of patients. Occasionally patients are very nervous of having a root canal treatment done, and we can offer sedation. Though sedation is not a method of pain relief, it reduces the patient's anxiety and can bring down pain thresholds, making treatment a lot more comfortable. Subsequent to root canal treatment, patients may still suffer a little bit of sensitivity, especially if they've had sensitivity beforehand. We always explain that they may well continue subsequent to treatment. This is usually dealt with by over-the-counter medication, such as ibuprofen or paracetamol. This is always carefully explained to patients that medication has to be taken on a timed and a regular basis to be effective, as it is important to have a certain level of analgesics within the blood system subsequent to treatment. Now, everybody is slightly different, and some discomfort may be of a day or two, or may last up to a week here, but these are carefully explained to the patient, and if it persists for any reason, we will gladly get the patient back and to re-examine. Root canal treatment is usually carried out over 1 or 2 visits. If the pulp is only inflamed, the ideal treatment time is 1 visit. Most of the pulpal contents can be removed in 1 visit. The tooth can be cleaned and shaped adequately, it can be disinfected, and then it can be filled again. However, if the tooth is infected, or if there's pus which is draining from the canal, more than 1 visit may be required. Quite often it's 2 visits here when the tooth is initially cleaned, disinfected, and an antiseptic solution is placed within the root canals. This is usually left in place for up to a week, and the little hole that's made within the tooth is temporarily sealed. At a subsequent visit, if the canal is still dry and it is not leaking, then the root canal treatment can be completed. There are occasions, especially when there is possibly a large abscess and there is still drainage coming out here, that a 3rd or maybe even a 4th visit may be required. Once treatment has been completed, the tooth is sealed either with a temporary or a permanent restoration to ensure that further leakage does not occur. It's at this stage that the patient is then referred back to the dentist to continue with restorative treatment.